Briefing newsmen in Calabar after a town hall meeting with some traditional rulers at the palace of the paramount ruler of Ifo. The executive director of Hakara Carewell Initiative, Mrs. Vivian Dominion Bassi, stressed the need for parents and caregivers to ensure that their female children within the ages of 9 to 14 take advantage of the free vaccination. Mrs. Bassi, who led a delegation of medical personnel to the various strategic places of the town hall meeting, explained that the 5-day multi-age cohort campaign, which would be flagged off tentatively on May 27 to May 31, 2024, was designed to prevent children against cervical cancer. She hinted that health workers would visit all primary and secondary schools for the vaccination to reduce the burden of cervical cancer, which remains the second most common cancer among women in Nigeria.
The human papillomavirus vaccine introduction and launch in Calabar South and Calabar Municipal in Cross River State in general will start on May 27th this year. It is a vaccine that protects the woman or the young child from cervical cancer and other human papillomavirus infections. So the target group is girls aged between 9 and 14 years. We've been going to schools, churches, and communities to sensitize them about the launch of this vaccine.
Dr. Lauria Jima of the State Chapter of Medical Women Association of Nigeria said that the health workers will not only be stationed in all government health facilities for the exercise, but will also visit various markets, churches, mosques, orphanage, among others. She added that the vaccine would be made available in the health facilities as part of routine immunization after the campaign.
We want all our young girls to be vaccinated. We will give them this human papillomavirus vaccine. Before the age of 15, they should receive this vaccination so that they can be protected for life. And 70% of our women should get themselves screened for this cancer, which we medical women, we are screening women every month, because in the sub-Saharan, where Nigeria is part of, this cervical cancer, after breast, cervical cancer is the second cancer that is killing our women. That is why even we as medical women, we are also joining hands with the state, with the government, with everybody to fight this disease we call cervical cancer. But with this vaccination on ground, it will help to prevent our young girls from coming down with this problem in the future.
Responding, the paramount ruler, Muri Munene Itam Organ Itam, described the campaign as a rare privilege and promised to sensitize the people of the area on the free vaccination through the use of town crier.
For my part, I pledge, and on behalf of my people, that I will assist in advocacy, isn't it? We educate the people.
The sensitization activities of Hakara Carewell Initiative is supported by Direct Consulting Logistics and International Vaccine Access Center in partnership with WAVA and National Primary Healthcare Development Agency with funding from Gavi. Eriti Christopher, CRBC News.